Hello and welcome to today's debate at Keele University. This debate is an entry for the Institution of Medical Ethics Student Debate competition. We have 4 medical students debating the motion, too much importance is placed on autonomy in medicine today. Arguing for the motion, we have Lauren Frame and Madalina Pasca. Arguing against the motion, we have Gibson and Harpal Patel. We will begin by hearing from Lauren arguing for the motion.
Autonomy is defined as the freedom of an individual from external control or influence. It is an ever-evolving concept that has developed the doctor-patient relationship from its paternalistic origin into a far more patient-centred, mutualistic kind. With these changes in the doctor-patient relationship, one could argue that too much emphasis is now placed on autonomy. Without the extensive medical training that doctors undergo, patients are ill-equipped to make decisions regarding their health. After years of medical training and experience, the doctor is competent in deciphering the best course of treatment or advice to give a patient. Therefore, any patient seeking a medical opinion should be prepared to follow it, knowing that they are being advised by a trained professional. A doctor acting in the patient's best interests will take into consideration the 4 pillars of ethics: beneficence, non-maleficence, justice, and autonomy, and ultimately will work to provide the patient with the best outcome possible. Whilst autonomy must be addressed, the doctor must also make sure that they regard beneficence and non-maleficence by guiding the patient so that no adverse events occur. At which point, however, do you prioritise beneficence over autonomy? Another issue arises if the patient were to make an unwise decision or indeed the wrong decision. Who does the responsibility fall down to? At which point do both the doctor and patient relinquish control or regain power over the decision-making process? This threatens the development of a default relationship whereby neither party assumes responsibility, which further puts the patient's health at risk because no interventions are decided upon. Furthermore, it could be said that in giving the patient full autonomy, the doctor allows the patient to put themselves at risk. Do no harm is one of the fundamental principles of medicine, and therefore the doctor should be doing everything within their power to ensure that the patient receives the best medical treatment. Another concern with modern medicine's overemphasis on autonomy is that it encourages patients to assume a consumerist approach to healthcare services.
There are many definitions of autonomy, but essentially it is the freedom to determine one's own actions and behaviour, being self-governed and independent. And the Mental Capacity Act of 2005 states that every adult with capacity has the right to autonomous, informed decisions. The proposition described autonomy as an ever-evolving concept, but we propose that the right to freedom is and has always been essential in all spheres of life. Autonomy is a timeless concept, and its increasing emphasis in medicine today is crucial to permit individual liberty of choice. The Western world places great emphasis on medical intervention. However, our society is highly diverse and multicultural, with people holding a variety of norms, values, lifestyles, and health beliefs. For example, some cultures are less medicalised and do not place such value on medical intervention. As such, often the ideas and desires of the patient do not align with those of the healthcare professional, who may only be seeing the situation through a biomedical lens. They must instead look beyond this in a more holistic, multidimensional way, appreciating the patient's idiosyncrasies and spirituality. Furthermore, studies have shown that people from differing socioeconomic groups approach healthcare very differently. Some patients are afraid to ask questions and take a more passive role in consultations and treatment. Thus, a lack of autonomy leads to patients feeling powerless in matters relating to their health and often helpless in the hospital environment. By educating people about their illness and treatment and encouraging them to engage in decision-making, you are empowering them to take ownership of their health and their body. By virtue of the nature of medicine, fundamentally, there is a trained healthcare professional and more often than not an unmedically trained patient, so there is always the possibility of an imbalance of power. Patient education and involvement will help redress this balance, restoring confidence in the individual and inspiring them to be autonomous over their own health. Without respecting autonomy, you perpetuate inequality.
I start by responding to the main point of the against side. So they are saying that by placing a lot of importance on autonomy, that will encourage the patients to take responsibility of their actions. We want to bring to attention the fact that patients react differently when given a lot of freedom or increased amount of information. We know that the given information, the treatment should be adapted to the patient's need, knowing that some patients have a negative reaction when trying to be involved in the decision-making process or when faced with the reality of their situation. By giving too much autonomy, the patient has a high chance of going to feel under pressure and anxious, and that can lead to an extended period of recovering and can ruin the relationship between the patient and the doctor. Going to our side of the table, we want to show how placing too much importance on autonomy that can slowly lead to the devaluation of the medical profession. We know that it's in the human nature for the patient to have unrealistic expectations from the doctor. Professionals are confronting patients asking for everything that can be done for them. The fact that nowadays access to information is so much easier can lead to patients thinking that every innovation existing in medicine and science can be applied to their treatment. The difference is that the patients do not have the formal education of the doctor, therefore they are not taking into account all the other major factors that can influence this decision. In comparison, a doctor has a responsibility of taking into account every major factor, so they have to respect justice, look at the safety of the treatment. The increased expectation can put the doctor in a very difficult position where they have to respect patient choice, but at the same time they might not have the right or possibility of doing so. Because the patient believes that their autonomy should be always respected, therefore that's the cause of us placing too much importance on autonomy. At the end of the day, when they will be confronted with the reality, they might feel angry or even disappointed because their choice wasn't taken into account, leading to a loss of trust in the medical profession, therefore just destroying the main point of having autonomy in the first place, that's it, to gain trust of the patient.
So regarding your point about some patients not wanting to accept the responsibility because they're feeling nervous and that the doctor should make the decision for them, yes, some patients do feel like that. However, lots of patients may want to be in control of their health, and therefore the doctor should gauge the situation and read this on a case-by-case basis. The doctor should always give the patient the choice at the end of the day. And regarding Lauren's point that the doctor is a trained medical professional, so they are the expert and the patient should follow their advice, I argue that the patient is their own expert because they have they're the ones that are feeling the symptoms and the feelings and the consequences of their condition, and therefore they know themselves better than the doctor knows them. Okay? And another point, you said that if patients had less autonomy, then the doctor would look into their best interests. However, I feel like some doctors can take advantage. So if you looked at this Shipman inquiry, you'd see that hundreds of people were killed by Dr. Shipman. And Simon Bramall last year inappropriately marked his initials on patient livers during surgery, which was very inappropriate. Another point that I like to make is that if the doctor-patient relationship was paternalistic, then the patient may be reluctant to tell the doctor all their problems and opinions because the doctor won't fully listen to them, and therefore the patient's involvement in their treatment may not be active. As a result, the patient will be less likely to adhere to the treatment, and at the end of the day, it's the doctor's job to ensure that the patient knows all the facts relevant to the diagnosis, prognosis, and the treatment, and the final decision should always be the patient's.
Fundamentally, medical professionals have the responsibility to provide patients with information regarding diagnosis, prognosis, and treatment using their knowledge and experience. The doctor must act in the best interests of the patient, and on some occasions this means being proactive, making a decision, and then implicating said decision. Whilst it is important to recognise that autonomy is an important part of any consultation, it is equally, and if not more important, to realise that when it comes to making decisions regarding healthcare, those who are trained within the field and are more competent, informed, and knowledgeable on these specific matters. Therefore, the logical process is to follow the guidance of a healthcare professional. Whilst a doctor must respect the patient's wishes, the patient must also acknowledge the doctor's training. In doing so, they may be able to achieve a mutualistic relationship whereby the patient is actively involved in the decision-making process, whilst also taking into firm consideration the doctor's advice and recommendations. After all, the priority of both doctor and patient is the patient's well-being. It is just that the patient may not see their well-being in the same light that the doctor does.
To summarise, although the 4 pillars of medical ethics seemingly create a conflict of duties for healthcare professionals and appear here to be at war with one another, they in fact can coexist and be synergistic. The healthcare professional can be beneficent, non-maleficent and just, sharing their knowledge and fully educating the patient without imposing their views on another person and respecting individual liberty. We agree with the proposition that some patients prefer to be more guided about treatment. This owes to the need for adaptability and good situational judgment in healthcare professionals. Harpal and I recognise that the human condition is inextricably complex. Humans make mistakes. Madeleine L'Engle once wrote, "To take away a man's freedom of choice, even his freedom to make the wrong choice, is to manipulate him, as though he were a puppet and not a person." John Stuart Mill said, "Over oneself, over one's own body and mind, the individual is sovereign." Thank you.
Thank you.